Post-traumatic stress disorder. Post-traumatic stress disorder, or PTSD at a glance. 70% of people have experienced a traumatic event in their adult life. At least 20% have been diagnosed with PTSD because of it. 5% of Americans have PTSD at any given time. Women are about twice as likely to get PTSD in their lifetime than men. People who have experienced domestic abuse, sexual assault, or have experienced combat have an increased risk of developing PTSD. People with PTSD have among the highest rates of healthcare usage. Most likely victims of PTSD. Anyone who is a victim, witnessed, or has been exposed to a life-threatening situation. Survivors of a violent acts such as domestic violence, rape, sexual, physical and/or verbal abuse, or physical attacks. Survivors of unexpected dangerous events such as a car accident, natural disaster, or terrorist attack. Combat veterans or civilians exposed to war. People who have learned or experienced an unexpected and sudden death of a friend or relative. Emergency responders who help victims during traumatic events. And children who are neglected and or abused physically, sexually, or verbally.
Living with PTSD. Any traumatic event has the potential to cause PTSD. Many people have different levels of tolerance and may not develop PTSD from the same event, or even at all. Some more common events that can cause PTSD are military combat, violent personal assaults, serious road accidents, prolonged violence, abuse, and neglect, witnessing violent deaths, natural disasters, and experiencing an unexpected life-threatening injury or situation. Overt symptoms of PTSD are often not consistently exhibited. However, many symptoms can consistently be felt, such as anxiety, compulsive needs to do certain things, and depression. Certain events, images, smells, noises, and other triggers can cause episodes where symptoms resurface. Common symptoms of PTSD include reliving the events of the traumatic situation in the form of nightmares and flashbacks, avoidance of the situation or avoidance of situations that remind of the event might include avoidance of doing certain activities, avoiding images depicting the event, seeking distracting activities to avoid thinking about the event. I definitely know that one firsthand. After a house fire, I could not look at images or movies containing house fires or fire in general for many, many months. Negative changes in feelings or beliefs, changes in feelings towards yourself and others, avoidance of relationships, anxiety, depression, fear, guilt, aggression, irritability, hostility, and mistrust, loss of interest, emotional detachment, insomnia, forgetting parts or all of the traumatic event, trouble concentrating, easily startled, feeling a need to have your back to the wall in an open room. Again, I know the symptoms, I've experienced symptoms in this category, specifically the insomnia after the house fire. I couldn't sleep until someone else was awake in the house to make sure that there was no fire happening. So it is definitely not a fun thing to experience. Effects on you and those around you. Many people are so affected that they have to quit or take breaks from work or school. Many experience memory problems or trouble concentrating. Increases negative emotions and can have severe impacts on relationships. May cause turbulence within the home. Someone experiencing PTSD due to long-term trauma might have difficulties adjusting to everyday life. That could be someone who's been in a long-term abuse situation, or maybe someone who has been in combat for many years. PTSD may also lead people to engage in avoidance behaviors such as drinking, smoking, drug use, and other poor health habits which can cause further problems and turbulence.
Treatments. Brief electric psychotherapy, BEP, is where you relax and recall memories about the event, refrain from negative thoughts about it, and write it down and throw away the paper. This will symbolically help you let go of the events if you get them out there and then release them. Narrative exposure therapy, NET. Talk about the events in your life, mostly the traumatic ones, and put them in a story, like chronological order. This most likely helps you get a grasp of what happened, how it happened, and help you come to terms with it. Written narrative exposure. Therapist assigns a patient with a writing task about the traumatic event and leaves, comes back, and then they discuss it. Antidepressants are also a treatment, which we will talk about now. Medication treatments. Prazosin helps you sleep through the night, and I read reviews on this, and it says it greatly reduces night terrors. People who've taken it have experienced less dreams, most likely. And Zoloft helps with stress and panic attacks, relieves general anxiety associated with PTSD. And alcohol is what a lot of people turn to, but it's not a valid treatment for PTSD, and people have said it makes it worse. So, don't self-medicate. Exercise can be the most beneficial of all these medications, and studies have shown that is a little more effective than prescription drugs in most cases. So, healthy amounts of activity will do you wonders. And these are the references.